Hi, welcome to HIMS TV. My name's Dylan Yogendra. I'm the managing editor at HIMS EMEA. Today, I'm delighted to have with me Professor Ganapathy, the director at Apollo Telemedicine Networking Foundation and Apollo Telehealth Services in India. Professor Ganapathy, can you give us a little bit of background to your role and your organization, please?
Thank you for having me on the show. It all started in 1998 when the word telemedicine was literally unknown, and I actually heard that word for the first time. I was the neurosurgeon. Actually, I was a past president of the Neurological Society of India, and I was strongly involved in technology. I started the first stereotactic radio surgery unit in the country. So somehow I got bitten by the IT bug, as you call it, in 1999. And I felt that as a neurosurgeon, maybe a few thousand people, a few tens of thousands of people I could help, but not the huge numbers which I thought which I would be able to do if I could bridge the urban-rural health divide. Just to give you an idea, India is indeed a paradox. We do have our problems, the doctor-patient ratio, the number of hospital beds available, and now, of course, the COVID time, the number of ventilators available are much less. At the same time, the progress in information and communication technology has been phenomenal. Today, we have 1,000,000,000, 1,000,000,000 mobile telephone communications, and about 60% of India are already using smartphones. So I thought, why not use technology to provide remote healthcare to suburban and rural India? So this was how the whole thing started. The first 5 to 10 years, I spent the entire time in evangelization, in just talking to people about telemedicine, telemedicine, telemedicine. Telemedicine was a dirty word at that time. Incidentally, I personally don't like the word telemedicine. I prefer to use the word telehealth, because today we are talking of health. We are no longer talking of a doctor and a patient. We are talking of a healthcare provider and the beneficiary.
Absolutely. Thank you for that, Professor Ganapathy. I wonder if we can just touch on one of the points that you just addressed there and the COVID situation. I don't think we can look too far beyond the COVID situation, but can you tell us a little bit about how digital tools and telehealth perhaps can help India out of this situation? Also, the rest of the globe, of course. The telehealth phenomenon is taking place across Europe, definitely across the US. And I think we're talking about it in terms of virtual care over here. But can you tell us a little bit about the situation in India and how you think the digital tools can help take us out of this situation, please?
One of the reasons why telehealth never took off, there was no radical changes, because the legal position was still not clear in India. Thanks to the pandemic, on March 25th, 2020, the government of India notified the telemedicine practice guidelines, and what was a gray area till then now became black and white. So this was people realized that telehealth was not an option anymore, because the lockdown was introduced, there were travel restrictions, etc. We often forget that because of the COVID, it doesn't prevent people from having other illnesses, head injuries, acute appendicitis, a brain tumor, headache, neck pain, etc. So because of the lockdown, the only way people could get healthcare was for a doctor to virtually go to the house of the patient on a giant TV screen. So I think a strand of RNA really acted as a global chief transformation officer, if you would like to call it. And what we were not able to achieve for several years, the pandemic quickly transformed everything. That was in 2020. As you know, unfortunately, in the last couple of weeks, the second wave has hit India very badly. And right now, we are almost encountering about 3.5 lakhs. That is 350,000 people are being tested as positive every day. But simultaneously, what the media probably is not projecting adequately is the fact that digital health has taken a tremendous, I just can't give you the exact numbers. It is not just teleconsultation. It is not just advising patients at home. Now, our own unit, for example, we run a tele-COVID ICU. And today we have hundreds of patients on ventilators, on oxygen support, etc., where my ICU consultants were intensivists, board certified intensivists, critical care specialists, etc., advise a general medical doctor on how to manage the critically ill patient. In addition to that, we do home care management. Many hospitals, like the Apollo hospitals, we have a 1 week, 2 week program where every day the patient is called, a video call is made. We have nurses, we have nutrition specialists, we have counselors, etc. In other words, we take the doctor to your home, we take the hospital to your home, we take a laboratory to your home, and this has done a phenomenal work in addressing the tremendous shortage of beds, which obviously occurs in any country in the world when COVID becomes a pandemic.
I think that's so interesting to know, so insightful. We really appreciate that colour to what's going on actually in India. And it's so reassuring to hear that digital health is playing such an important role. I wonder if we can just zoom into the patient. Are patients on board with the use of telehealth from your experience?
That's a very good question. As I told you, I would like to review it in the last 20 years. The first 10 years, even doctors. Now, you are asking me about patients. I think equally important is the response of the medical community. How much are doctors interested in telemedicine? At the end of the day, in my opinion, it is a doctor who must be a brand ambassador for telemedicine rather than the patient. Particularly in a country like India, where the doctor-patient relationship is so profound, it is not impersonal as perhaps it is in some other countries. When a doctor says, look, I would like to see you on a screen, why are you bothering to travel 100 miles, 200 miles, 500 miles to come and see me? So because of the pandemic, people have realized, both the medical community, the patients, and to me, what is the most important, the administration. Telemedicine can never ever take off in any country unless the political will is there. And today I'm extremely happy as a telehealth evangelist that the political will is there. The government of India, every single state government in India, as you know, every sixth human on planet Earth lives in India, and telemedicine in India, if it takes off, it is equivalent to digital health anywhere in the world taking off. And today we have 150% administrative support and even economic support from the administrators, from the political will. The Prime Minister of India, during every national address to the country during the pandemic, has repeatedly mentioned the word telemedicine, 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 and he has advocated that healthcare should be provided through remote healthcare from your home, and he has discouraged people from going to a hospital, and he has encouraged the hospital to go to the patient.
It all sounds very, very positive. I wonder if there are any barriers or challenges that you foresee later down the line. Is there anything that you can talk about from things that you've learned from, perhaps, please, Professor?
I have never been a diplomat in my life. I like to call a spade a spade. I think for telehealth to take off exponentially, there has to be a business model. At the end of the day, I coin a term called YFM. You have all heard of Wi-Fi, you have heard of WiMAX, but I use the term YFM, WIIFM. What is in it for me? At the end of the day, every stakeholder in the ecosystem, there should be something for him. Philanthropy at the best can start a telemedicine system, but eventually it will die a natural death. If telemedicine is to become center stage, if it is to be incorporated into the healthcare delivery system, every player has to be compensated in some way. A great achievement of the Indian government is that very recently insurance companies have been authorized to reimburse teleconsultations. This was what was done in the United States a couple of years ago, and this radically changed the utilization of telemedicine. I'm hoping that in India also, once insurance companies reimburse a medical consultant for his time, it will take off. So the answer to your question is, what is in it for me? We need to develop a business model. At the end of the day, somebody has to pick up the bill. It may be the government, it may be the insurance company, it may be the individual, etc. This, I think, is a barrier. We need to incentivize the patient, the doctor, the healthcare administrator, everybody. We need to use both a carrot and a stick. Unless we adopt this, telemedicine will take off, but not in, it won't blast into outer space. But I think we will reach that critical mass essential for a takeoff. I'll just give you one example. I'm on the editorial board of several journals in India and my international journals as well. The number of articles which have been submitted, not only in telemedicine journals, but even in specialty journals during the last 8 months have been absolutely unbelievable. So I think the medical community is realizing that telemedicine is here to stay.
Absolutely. I think that chimes with a lot of what we're hearing as well, Professor. Telemedicine can be used for preventative health, to reduce costs and to improve patient care. And it sounds like stakeholders are aligning and coming on board as well.
A very major component of telemedicine in India is what is called the public-private partnership. 5 years ago, we ventured into the Himalayas at a height of 14,500 feet. The government of Himachal Pradesh, they were not able to provide healthcare at 14,500 feet. So we started the world's first 24/7 emergency medical services. Several papers have been published, chapters have been published. In fact, I'm talking about this at the eHealth European Health Summit in Portugal in a week from now. So this started off, kick-started, and today we have 7 state governments in Tamil Nadu. We do 10,000 teleconsultations every single day. My team now has reached the 10,000 mark. We have done more than 13 million teleconsultations in the last 15 years. And what is most exciting to me is I'm able to get a specialist and a super specialist available on a screen, even in villages in India, at no cost to the patient, to the end user. The government, the individual state government subsidizes this, and we do it as a no profit, no loss basis.
Wow. Remarkable effort. Thank you for sharing that with us, Professor. Unfortunately, we're out of time, but we look forward to learning a lot more from you and your team at the event coming up very soon as well. So thank you again for your time and take care.